Hola, ¿qué tal? Muy buenos días.
Hello, good morning, good afternoon to all. Thank you for connecting to this press briefing of the Pan American Health Organization on the pandemic, on the COVID-19 pandemic in the Americas. My name is Sebastián Oliel, Communications Department of PAHO, and this session will last about an hour. We have received your questions by email, and you will be able to ask questions as well through the chat and on the Q&A button. Also, always remember to add your name and medium when you send your questions. We have simultaneous interpretation to English, French, Spanish, and English, and you can opt for your language by clicking on the interpretation button. Today, the director of Pan American Health Organization, Dr. Carissa Etienne, will give you a report on the status of epidemiology, vaccination, as well as the social and economic impact of the COVID pandemic. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Ciro Ugarte, Dr. Ciro Ugarte, the Director of the Department of Health Emergencies, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19, both from PAHO as well. Now I invite Dr. Etienne to share her words with us.
Good morning to you, and thanks for joining today's press briefing. As of this week, our region reported nearly 74 million cases and 1.9 million deaths from COVID-19, accounting for more than a third of COVID cases and more than 40% of deaths reported worldwide this week. And while new cases are down nearly 20% from last week, many countries, including the United States, are seeing a resurgence of infections. In North America, the United States of America and Mexico are reporting an increase in new infections across most states. Many Central American nations are also seeing cases, including in El Salvador, where a consistent increase in daily cases was noted between late June and early July, and Guatemala, where at departmental level, there was surges in COVID deaths in the past 2 weeks. In the Caribbean, infections are also going up. Cuba reported the highest number of weekly cases since the start of the pandemic, and cases have tripled in the British Virgin Islands just weeks after reopening to cruise ships. Meanwhile, South America is reporting a mixed picture. COVID infections, hospitalizations, and deaths are dropping across most of the continent, including in Brazil, Peru, Uruguay, and Chile. However, infections are once again mounting in Argentina and in Colombia, and they are reaching their highest ever levels, raising concerns about the health system's ability to cope, as 98% of ICU beds are already in use. Cases rise when complacency sets in. We are all tired, but after experiencing successive peaks of infections in the same locations, we must break the cycle by embracing public health measures early and consistently. When variants of concern circulate, it's even more important that countries step up surveillance, especially while vaccine coverage remains low. 1 year ago, preparations were underway to launch what would become the COVAX facility. Yet today, just 1 in 10 vaccines administered worldwide have been here in the Americas. And even with limited bilateral deals, months of COVAX deliveries, and recent donations from countries like the United States, only 1 in 7 people in Latin America and the Caribbean have been fully protected against COVID. Money, more than public health, has determined how quickly countries can secure the tools that they need to combat this virus. As countries that struck deals with vaccine manufacturers pull further ahead, vaccination coverage continues to linger in the single digits for much of our region. In Chile, nearly 58% of people have been fully vaccinated against COVID. In Uruguay, 55% of people are protected. The United States has vaccinated nearly half of its population, and Canada isn't far behind. Meanwhile, Paraguay and Jamaica have fully vaccinated less than 3% of their population, and Honduras and Guatemala have yet to protect even 1% of their populations. The US government has generously donated nearly 12 million COVID-19 vaccine doses to countries in our region over the last few weeks, and additional deliveries are on their way with PAHO's help. These vaccines are bringing hope to countries that would otherwise have to wait months to secure even a fraction of these doses. And that's why we continue to urge donors and countries with vaccines to share them with our region. This remains the only way for many countries in our region to secure the doses that they need quickly. We are concerned about Haiti, which in the midst of considerable political turmoil has seen thousands of people displaced by growing violence and instability, and crowded shelters could become active hotspots for COVID transmission. Limited supplies and violence are also hindering the ability of health workers to safely care for patients in need. In some cases, patients may be avoiding seeking care due to safety concerns. PAHO, along with other partners, is committed to supporting the Haitian people in these uncertain times, and we urge other international organizations to join us in supporting the COVID response. Over the last few weeks, we've delivered considerable amounts of personal protective equipment. We've helped expand care for persons sick with COVID-19 and provided thousands of test and laboratory materials to ramp up surveillance activities in Haiti. We've also helped train community health workers and have supported the Ministry of Health in preparing for COVID-19 vaccine introduction and setting up new systems to dispel rumors and COVID misinformation. While the situation in Haiti is unique, many countries in our region, from Colombia to Brazil and now Cuba, are experiencing waves of protests due in part to the impact of this pandemic. COVID-19 has not just ravaged our health systems, it has fractured social protection programs and destabilized our economies. A new report released by the Economic Commission on Latin America and the Caribbean last week paints a grim outlook for our region. More than 7 million companies have closed in Latin America and the Caribbean in the wake of the pandemic. More than a third of people in our region are living in poverty, and 1 in 4 worry about where they will get their next meal. Unemployment rates are higher here than any other developing region. The report shows how the pandemic continues to be fueled by inequality. And unfortunately, our region is the most unequal in the world. We urge countries to continue prioritizing health and social safety nets as part of their COVID response, and as they turn their sights to COVID recovery. Social protection is key, both to help people adhere to the public health measures that we know work, and to rebuild more inclusive, equitable societies. Across our region, we're paying the price of chronic underinvestment in health. So now is the time for countries to break this cycle by applying a public expenditure in health of at least 6% of GDP to health systems and to chart their path to recovery. But now also is the time for countries to renew their commitment to Pan-Americanism and solidarity. As we've said many times before, health is a fundamental right. It was so before COVID, and the unequal burden of this pandemic has painted the urgency of health equity under new light. Thank you.
Muchas gracias, doctora Etienne. Vamos a pasar ahora entonces a la sección
Thank you, Dr. Etienne. Now we will go to our question and answer session, and we have received questions from you by email, and there are questions on the Q&A. Please include your name and medium when you send us questions. The first question is from Dalien Politi from the New York Times in English.
Most concerned about right now that have a mix of rising cases and low vaccination rates? Is there an effort to target these countries specifically with donations? Dr. Etienne?
So many thanks, Daniel, for this question. Rising cases and low vaccination rates throughout Latin America and the Caribbean are certainly a big concern for us here at PAHO. If we do not ensure that more equitable distribution of vaccines, not only in the North, but also in the global South, COVID-19 could continue circulating for years to come, ravaging health systems, taking lives, destroying livelihoods, and preventing things from ever getting back to normal. It is the ongoing disparity in access to vaccines that continues to prevent this, particularly given that despite best efforts from COVAX to secure doses, virtually all vaccines have already been purchased by high-income countries. Of course, we have been very concerned about those countries in our region that have been hardest hit by this lack of supply. And for them, vaccine donations have been and will continue to be an absolute lifeline. So this is why it is vital that we shift the conversation away from booster shots in the North to ensuring that everyone everywhere, and particularly healthcare workers and those most vulnerable to severe disease, are protected first. And there is enough scientific evidence that the current vaccines, together with the proven public health measures, are today effective against all variants of concern and can help save lives. So the quickest way to get the shots into the arms where they are needed the most today is through donations. Therefore, we welcome the recent donations from Canada through COVAX, and we thank the United States for its donation to Honduras, Bolivia, El Salvador, and other countries. And we also thank the other countries who are beginning to engage in terms of donation of vaccines. We stress that these doses should be donated to those countries where low vaccine coverage and high disease burden make them urgent priorities. So as we've said before, this is a great start, but we need more vaccines in Latin America and the Caribbean, and we need them now. Over.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. The next question is from Ariel Boglet from the Tribune in Bahamas in English. He asked,
facing supply challenges, and is it only with AstraZeneca? And also, when will countries like the Bahamas get the shipment for Pfizer? Dr. Barbosa?
Thank you for this question, Ariel. The COVAX facility has already delivered around 100 million doses to 135 participant countries. But as our director said, this is still a very limited amount of vaccines if we are talking about to get all the vulnerable groups protected and looking for the future to have the immunization coverage that we need to control the transmission. The COVAX facility has faced challenges to receive the vaccines from some producers. The AstraZeneca vaccine produced by Serum Institute of India, for instance, that had a contract with COVAX to deliver 161 million doses, only 29 million were really delivered, and the government of India has not yet allowed the export of these vaccines to be reestablished. Other sites of AstraZeneca also faced some regulatory challenges because all of them needed to receive the emergency use listing from WTO. So they also reduced around the 40% of the vaccines that were estimated to be delivered from February to June. And the Pfizer started delivering vaccines in February, but it's a small amount. So the total vaccine estimation from Pfizer, it was around the 15 million doses. Pfizer has delivered around the 12.5 million doses. As the revolving fund is working with the producers to get more vaccines, but the Bahamas will receive vaccines in July and August through COVAX. We are also working, it's estimated around the 57,000 doses to the Bahamas, but we have also other sources of vaccines to the Caribbean countries, including the Bahamas. We are working with the CARFA, the Caribbean Public Health Agency, and the US government to facilitate the deployment of the 3 million doses that the US government is donating to the Caribbean. At the same time, the revolving fund is closing negotiations with the producers that will offer another source of vaccines to complement COVAX and the bilateral agreements that the countries have in order to achieve the immunization coverage that will allow the countries to control the transmission. Thank you.
Gracias, doctor. Tenemos varias preguntas.
Thank you, doctor. We have several questions on the variants. I'm going to read some of them. Andrea Meraz from Grupo Formula Mexico. She asks how many variants of COVID are circulating in Mexico and in how many of the states, and are there some that are of concern to PAHO? Also, there's a question about the situation of the Delta variant in the US. And from Argentina, Juan Manuel Meves asked what recommendation for the countries in the region such as Argentina to avoid the dissemination of the Delta variant, and what characteristics does this variant have in terms of transmissibility and mortality? Thank you, Sebastian. We have several questions which are quite precise in terms of their geography. So let me try to answer. Regarding Mexico, let me say that as one of the genomic surveillance networks, which are among the soundest of the region. And it's run by INDRE. It's one of the regional reference labs for sequencing. So thanks to this capacity at state level in Mexico, Mexico has reported more than 15 sequences in global databases, detecting almost 24 different variants distributed among the 32 states, including the concerned variants Alpha and Gamma, in addition to the Delta variant. Even though for this one at a lower percentage. Regarding the information from the last 28 weeks, the most widely detected variant, about 31% in the sequences, continues to be the B11519, which is presenting at global level, but it has not been classified as an variant of interest of or a variant of high concern. However, it is likely that this variant be replaced in Mexico in the next few weeks by others, such as the Gamma variant, which is reaching 23% of the reported sequences. All of this in a process to see how the virus displaces one variant for another. And this is how viruses behave. And this has been seen repeatedly globally. Regarding the question about the Delta status in the United States at present, according to data reported by the genomic network led by CDC, it's 52% among detected variants in the United States. That's for Delta, followed by Alpha and Gamma variants, in addition to other variants, which are much lower in their proportion. While it has been demonstrated that the Delta variant has a higher transmissibility than the original virus, and in comparison to other variants of concern, it has not demonstrated to be more aggressive or lead to clinical forms of the disease or in the contagion rate. And this is a general comment that has to do also with the question asked by Argentina. So due to all of the above things, the public health control measures that have been adopted previously continue to be highly effective to stop transmission, including Delta variants. And these measures include social distancing, quarantine of contacts, wearing a mask, washing your hands, and also implementing vaccination schemes. I hope I have covered all the questions that were asked on the theme of variants. Thank you very much. Thank you. The next question is by Daniel Collin from TN 23 Guatemala. Given the increase of cases due to COVID-19, is it recommendable that students in Guatemala go back to schools next August? He says that the authorities are wondering about this. Uh, Given that the teachers are vaccinated, would there be no risk? Dr. Ugarte, thank you for your question, Daniel. This is an aspect that involves other countries too. In the case of Guatemala, it is right now in an increase, a quick increase in the number of cases. The country has gone through the highest transmission levels from the beginning of the pandemic, as is seen in other countries as well. The incidence of COVID in young adults and teenagers, the proportion of 9% of all cases are in this age group. So in this context, the health ministry enabled a digital platform for instruction of teachers and the push is to vaccinate all teachers using the 1.5 million doses donated by the United States to vaccinate teachers in order to open schools. You need to do a risk analysis, and that should be the basis for the final decision, especially given the location of the schools too. It also is related to where students live. And we also need to take into consideration transportation modes from and to school, and also consider as well the alerts that Guatemala is normally recording through the alert traffic lights. And this it's very important to implement efficient mechanisms when schools are reopened, if they indeed are reopened in according to the scheduled date. There need to be effective mechanisms to detect and report symptoms appearing among teachers and support personnel as well as students in order to do surveillance, rapid diagnosis, and implementation of timely measures to reduce transmission. So reopening of schools should be based on a risk analysis and risk assessment, the epidemiological status, the ability to respond both at university and school level. In addition, the alert system should be considered. It already exists in the country, and and also by implementing the public health measures. All of this need to be balanced. So we need to balance the need to reopen schools. Of course, students have been affected, especially those who have no access to the internet or who have a hard time to receive learning virtually, and on the other hand, transmission, health protection for the whole of the population, including students and teachers. Thank you. Thank you, Dr. Ugarte. The next question on the chat is from Blanca Valadez from Milenio in Mexico. She asks how many people who have received one dose or the full two doses have gotten COVID, and how many have dead, and how many have died, and how do you explain this, Dr. Barbosa? Thank you, Blanca, for your question. Well, uh, it is, first of all, important to underline that for two-dose vaccines, full protection is achieved when the two doses are given. There are many studies demonstrating this to be so. The first dose may produce some level of protection, but it is the second dose that leads to full protection. So this is the first thing we need to underline. Secondly, no vaccine against COVID-19 or against polio or whatever the disease has 100% effectiveness. What does this mean? Well, it means that there can be breakthrough infections in vaccinated people. However, the cases that occur in vaccinated people are in significantly lower numbers than among the non-vaccinated. So when you say that a vaccine has, for example, that all vaccines that have been that have received the EUL by WHO, and that the revolving fund is distributing in the region on behalf of COVAX, have up to 90% effectiveness to reduce the most severe cases and deaths. So this means that yes, there can be breakthrough infections and hospitalizations and maybe even death in some of the vaccinated, because it is well known that some people have other immune system problems many times that don't allow them to develop the protection needed. This in senior people, this can happen more in senior adults than in other people. But in all the studies in our region and in other parts, it has been shown that the vaccine is providing protection. In the countries that have carried out, and there are very good high quality studies in many places, most people who are today in the ICUs are younger people. Why? Because older people have already received their full dose. Many times the deaths are reducing significantly among senior citizens because they are protected by vaccines. And therefore, PAHO is supporting the countries so that all the data are collected on deaths and on hospitalized cases to um, uh, confirm the effectiveness of the vaccines. So you should take the full doses. If it's a vaccine requiring two doses, you take them both. There are many publications all over the world, proving the high effectiveness of the vaccines available and their capacity to decrease deaths, hospitalizations, severe cases, and this will eventually lead us to control transmission.
Thank you, doctor. The next question is by Gerso Koyabe from Peru. He's saying that Peru has a clear drop in the number of cases and deaths of COVID-19, but they are expecting a third wave in August. What are PAHO's recommendations for Peru and other countries in the region to prepare given a potential third wave? Dr. Etienne.
For this question. As we have been saying over the weeks, we have seen cases and deaths from COVID-19 rise, fall, and rise again in numerous countries. And this pattern has been repeated several times. Countries relax after the first or the second wave. They open up the economy. People start to congregate in crowds or indoor places, and COVID-19 cases begin to rise again. So our recommendation to countries that are experiencing increased cases is to maintain strict public health measures to reduce transmission of the virus. We are working to make vaccines more widely available in our region. And however, we want to urge people to wear masks, to maintain physical distancing, to avoid crowds, to ensure good ventilation of indoor spaces as much as possible. Wash your hands frequently and get vaccinated as soon as you can. And we know that we repeat this over and over again. But we also urge public health authorities to continue screening for COVID-19, to ensure early testing for persons with symptoms, and to carry out contact tracing of those positive cases and isolate them, assist people in the contacts, particularly in testing and ensuring quarantine, and giving some support to people for isolation and quarantine. But also, authorities need to ensure that they can provide quality care. We all know that vaccination is the path out of this pandemic. Our goal is to increase access to vaccines in every country of the Americas and to increase coverage of vaccination in the countries, starting with health workers and those most vulnerable, and eventually reaching 75–80% of the population or more. So we also continue to urge people to get vaccinated as soon as a vaccine is available to you. And do not wait for a specific type of vaccine. And ensure you take 2 doses if these 2 doses are what is recommended. And just remember that the best vaccine is the one that is available to you first. The presence of variants of concern in many of our countries also make it more urgent to do everything that we can to limit the transmission of COVID-19. Thanks.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. The next questions come from several journalists, Danielle Politi from the New York Times, Lina Lieste from AFP, and also our journalists from Reuters. These are questions related to Haiti and Cuba, so I will start with the ones related to Cuba. In general, the question is,
recent turmoil in Haiti and how it could affect the health situation and slow vaccination efforts. Is there anything that needs to be done by government or other bodies, parties within the country or outside? Dr. Aldigueri?
Yes, thank you for these questions. First of all, as Dr. Etienne said last week, we want to express solidarity with the Haitian people in these uncertain times. And today, Dr. Etienne has also shared with us some remarks regarding the situation in Haiti. But I'd like to note that PAHO, since the beginning, has been closely assisting the COVID-19 response in Haiti in all its components, including the organization of health services for managing critical patients, the laboratory surveillance, the risk communications, and many other pillars of the response. We are ready to closely assist the Ministry of Health, Ministère de la Santé publique et de la Population, for the implementation of the vaccine plan in all its aspects, from logistics, cold chain, rolling out of the activities, adverse events surveillance, risk communications, and others. During the last month, PAHO has been involved together with the Ministry of Health in the trainings and updating of healthcare workers for vaccination activities and in setting up, for example, systems for controlling false rumors regarding COVID vaccinations. At this moment, in this complex emergency setting in Haiti, PAHO is closely coordinating with the government of Haiti, the government of the United States, and other international partners on the vaccination campaign planning. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. Y la segunda parte de...
Thank you, doctor. And the second part of the questions received in connection with Cuba, also in English.
Characterize the health situation in Cuba, and what information do you have about the efficacy or effectiveness of the Cuban vaccine being distributed? What impact could the protest have on COVID numbers? Dr. Ugarte?
Thank you so much for those questions. I will answer them in Spanish. La aglomeración de las personas
the crowding of individuals for protests, political, religious, cultural, sports reasons increase the risk of transmission. In particular, in cases such as Cuba, where you have the active transmission in many areas of the country over the last week, as stated by the director, there were 34,244 cases reported, and that accounted for the 34 increase compared to the previous week. And the highest figures were in Matanzas, Santi Espíritu, Cerro de Ávila, Mayabeque, Guantánamo, Santiago de Cuba, Camagüey, and Simpré. In Matanzas, as we all know, there is Varadero, and that's the place where there is an important number of tourists arriving. So the idea is to maintain all of the public measures, including physical distancing, the use of masks, frequent hand washing, and also to avoid crowding and also be alert at symptoms. All of the municipalities are having municipal transmission, and the public health authorities have confirmed the presence of the Delta variant in municipalities such as Matanza, that has had an exponential increase over the last couple of weeks, and up to June 10th, 3,480,023 individuals had been reported as receiving at least one dose of the two vaccine candidates, Abdale or the Soberana vaccine, and that represents 27% of the total population, and about 7 million doses have been administered as part of the clinical trials and also the various medical interventions, and this is every 100,000 inhabitants. And so the data and also the studies from Cuba indicate that there is an efficacy between 91 and 92% for that vaccine. Therefore, later information will give us the final data, in particular in the social environment, where we can have a better assessment of how these vaccines work beyond clinical trials and in the community in particular. Thank you very much. Thank you, doctor. We have other questions related to the Cuban vaccines. This is by Elena Gordon, who is with World National Radio Program in the US. And in English, the question is,
Cuba reported the highest number of weekly cases since the start of the pandemic, and yet lots of the population have received their homegrown Soberana and Abdala vaccine. What is the role of Cuba's vaccines in the domestic response? And also, what is the role of Cuba's vaccines for other parts of Latin America? Do you see them as promising, especially in the face of inequities and lack of access in the region? Dr. Barbosa?
Thank you for the question. I think that the epidemiological situation in Cuba was very well explained by both our director and the Ciro Gatti already. Let me just highlight that if we have a vaccine that requires 2 doses or 3 doses, in the case of the Cuban vaccine, you need to have the 2 or 3 doses in order to be protected. So we have seen in the region, in Uruguay, in Chile, in other countries, when they started the vaccination, sometimes the population has the false sense of security as the pandemic will finish next week or in 15 days, and this is not true. Now we know that the vaccine objective in the first phase is to protect the most vulnerable groups, the groups that have some risk factors to develop severe cases of COVID-19 and to die due to the disease. So we need to first protect these groups, and after that you need to reach a very high immunization coverage. There are some models that estimate this around 70 or 80% of the population to be covered. We don't have this in any country in Latin America yet, and we don't have this situation in Cuba for sure. Now, Cuba started the phase 3 clinical trial, and the Ministry of Health of Cuba also started their community intervention with the vaccines, but the coverage in the population is still not enough to protect. So Cuba, as the other countries in the region, will need to adopt more public health measures to see what's happening, how they can improve the effectiveness of this public health measure in order to reduce. The second part about the role of these Cuban vaccines. For other countries, we have already said that it's very important, this development of vaccines in Cuba and other countries in Latin America. The Latin America and the Caribbean, we are a very vulnerable region because we rely on importation, not only for vaccines, but for medicines, for PPEs, for ventilators, and other critical supplies to face a pandemic. So we welcome this development in Cuba and other countries. This is very important for the region. And we also have said that all the vaccines to be purchased through the revolving fund, to PAHO's revolving fund, needed to meet the same criteria. They need to receive the WHO emergency use listing in order to be purchased for the PAHO's revolving fund. So we are still at the early stages. Cuba will have to finalize all the clinical trials to present all this data to be analyzed. Thank you.
Gracias, doctor. Próxima pregunta nos
Thank you,
llegó.
doctor. The next question comes from Sarah Burton from Jamaica, 18 degrees north, and it reads,
all countries, regardless of how small, keep track of adverse events that may be related to the COVID-19 vaccines. Should they make the data publicly available? Also, from the data you have gathered on adverse events from the Americas, has it proved useful to PAHO in any way? If yes, how? Dr. Aldiguieri?
Yes, absolutely. PAHO recommends to all countries and territories a system for close surveillance of all adverse events following immunization. In Spanish, it's important to note it's spelled ESAVI. PAHO has developed, has trained Ministry of Health staff, and is promoting a regional surveillance system that aims to detect, notify, investigate, assess, and classify serious adverse events after immunization. Some non-serious adverse events with specific characteristics should also be investigated. So the PAHO, how it works. The PAHO immunization, regulatory and international health regulations staff and teams are collecting information from ministries of health and carry out regional analysis, which are then shared with all countries. So this provides a wider perspective on any adverse events. So the countries can expand from their regional, national scope to a regional and global scope. But very important, as we are talking about adverse events, I'd like to stress the fact that COVID-19 vaccines validated by WHO are safe. The benefits of vaccination are overwhelmingly positive, and thousands of lives have been saved by COVID-19 vaccination. Thank you.
Gracias, doctor.
Thank you, doctor. The next question is by Nicole Yapur from Bloomberg News, Venezuela. She's saying that last week, the Gavi Alliance, the Gavi partnership indicated that Venezuela had completed the payment for the vaccines through COVAX. However, PAHO has also warned that the availability of vaccines under the selected mode by Venezuela, that is to say, optional purchase, could be more limited. Does PAHO know how many vaccines could Venezuela receive? And also data published by OCHA with PAHO information indicated that as of June 18th, Venezuela had administered 1.3 million vaccines. Does PAHO have any update or detailed information on these figures? Dr. Ugarte, thank you very much for the questions. Nicole? Indeed, Gavi reported on the full payment by Venezuela to COVAX to receive the vaccine through this facility. We have understood that the government of Venezuela is coordinating with COVAX the options of the current vaccines and also to determine the vaccine to be received by Venezuela, such as Sinovac, Sinopharm. But anyways, there is no information regarding the number of vaccines to be received, but the good news is that the process is underway and that Venezuela is getting closer and closer to receiving the vaccine. We hope it happens as soon as possible and also as many as available. As to the number of individuals vaccinated or the number of vaccines administered, based on the last information we received, the latest information we have, that 2.2 doses have been administered, and those figures continue to rise, but we do not have further information on the places, the individuals, etc. Therefore, this is a topic that will certainly be clarified once the other vaccines arrive and administration is carried out through COVAX and all the help of all of the actors who are also supporting vaccine implementation. Thank you. Thank you, doctor. The next question is by Kevin Feldmine from Guardian in Barbados, and in English it reads.
Reported that Barbados was one of the Caribbean countries with the Delta variant. Barbados has introduced several public health measures like a curfew following a recent spike in cases. Is the Delta variant responsible for this spike? If so, what percentage of the overall cases was the Delta variant found? Dr. Aldigueri?
Thank you for this question. Regarding a change in transmission patterns and circulation of SARS-CoV-2 variants, it is important to do a sub-regional assessment. In the case of the Eastern Caribbean region, we know that at the moment the Delta variant has been reported in Barbados, but also in the French Caribbean with Guadeloupe and Martinique, and the Dutch Caribbean with Saint Martin, Saba, and Aruba. We also know from the experience of the recent past that a new variant introduced in a specific country can very quickly replace the pre-existing ones in a context of higher transmissibility. So as part of the PAHO Genomic Surveillance Regional Network, Barbados has obtained genomic information through the collaboration with the Sequencing Reference Laboratory at the University of the West Indies in Trinidad. Thanks to this collaboration, by the end of 2020, it was already possible to confirm the introduction of the Alpha variant in the country. Since then, according to the available information, this variant of concern has been circulating in higher proportion than other variants. We are talking about the Alpha variant. So the Delta variant has been confirmed in 4 cases associated to travelers. And at the moment, there is no evidence of community transmission or circulation related to the Delta variant. And as I explained in previous questions regarding Delta variant in Spanish, it is important to remember that regardless the circulating variant, all public health measures implemented to control the transmission, including social distancing, mask, isolations of cases, and of course vaccinations, are highly efficient and should be maintained. I hope I have answered the concerns of the journalist from Barbados. Thank you.
Gracias, doctor. Y una segunda parte de la pregunta de...
And a second part to this question, also in English, is the following.
Tobago is reopening its borders on Saturday. Given that the Delta variant found its way into the Caribbean through travelers, what advice that PAHO have for resumption of international travel to and from Trinidad and Tobago? And similar ha preguntado también Gebrick Alvarado.
Similarly, also from Newsday, we have received the same question, Dr. Ugarte.
To many other countries. I would like to begin emphasizing that if the decision to open the borders or to reopen the economy to tourism has been made, it is understood that the countries have analyzed the risk that it represents both for the tourism, but also for the country. In that regard, it is important to understand that it's impossible to eliminate the risk of the entering of any new variant, as Dr. Aldigeri already stated. And all the efforts to early identify those cases and have every measure possible to implement this social distancing, physical distancing, and all the public health measures, particularly the early identification of cases, isolation, quarantine, and also treatment of cases, and reporting, it's extremely important. It is not easy, though, to implement. So it has to be carefully drafted according to what is the capacity of the health services and systems in the countries. And I think that implementing those measures, we will be better off while we reopen the economy, at the same time we protect the population. There are many attempts that we may have, and it is a situation that must be adjusted according to what is the epidemiological situation at the country of origin and also the country of destiny. So these are measures that must be analyzed continuously and make a decision according to the risk analysis. Thank you.
Muchas gracias, doctor. Y ya estamos
Thank
llegando.
you very much, doctor. And we're reaching the end of this session on today. And the next question is by Rachel Knowles from the Nassau Guardian, Bahamas. And in English, it is as follows.
Bahamas have recently raised concern over an uptick in COVID cases and hospitalizations. Princess Margaret Hospital is at capacity with COVID-19 patients. Officials insist that vaccination is the best way to fight the recent surge. However, with limited doses available in the country, does PAHO recommend increasing restrictions to curb the spread of the virus? What other recommendations do you have for countries in this position that are trying to balance public health and economic well-being? Dr. Etienne?
So thank you, Rachel, for this very relevant question. Certainly, we heard just in the previous question, we heard Dr. Ciro Rogate opine on this matter. Early on during this pandemic, PAHO noted that it has not only affected our health and well-being, but also our economies and our whole of societies. We have referred to this as a triple crisis of health, social protection, and the economy. Balancing public health measures while reopening the economy has been a challenge for every country in the world. But countries should avoid thinking that they must make a choice between reopening the economies and protecting the health and well-being of their people. We believe that this is a false choice. We have seen time and time again that full economic activity cannot resume unless we have the virus under control. And to attempt otherwise places lives at risk and extends the uncertainty brought by the pandemic. Health and well-being must be prerequisites for reactivating the economy in the context of COVID-19. Because if the pandemic is not brought under control, economic reactivation will be very difficult. We know that public health measures work to control the spread of the virus. And each country needs to be responsive to their own national and local context and do the risk analysis that is necessary. We have already said that reactivating our economies must be done gradually and must be based on the evolving data about the virus's spread, about the health system's capacity. Data must always guide our actions against this virus. We must also recognize that it is necessary to make significant investments to effect change. And this means investing in health to strengthen our health system. Of course, PAHO has been calling in all countries to increase public investments in health to at least 6% of their GDP. And we believe that not only is it the right thing to do, but it will also help us to be better prepared to face future waves of this pandemic and future outbreaks. This pandemic has certainly underscored that health is a right and that rights should be guaranteed for all. But when some are left behind, all of us are at greater risk. And this pandemic has shown that. We must create the necessary health and economic conditions so that we truly leave no one behind. Thank you for joining us again.
Muchas gracias, doctora Etienne. Y ahora sí hemos llegado al
Thank
final.
you very much, Dr. Etienne. We have reached the end of today's session. Next week, July 21st, this session will be held at 11:30 a.m., 11:30 a.m. instead of 11 a.m. EDT, as we have already had in previous weeks, but we will be emailing you about this change, and you can find further information on PAHO's work in connection with COVID-19 on our webpage, www.paho.org. So thanks again for being with us, and we will be connected. Thank you. Greetings.